San Luis Obispo County health officials say whooping cough cases are on track to reach their highest level in about a decade. Last year, the county saw 18 cases of whooping cough. This year, 11 have already been reported, and officials expect that number to grow. So far, there have been no hospitalizations. The disease starts like a common cold with a runny nose and mild cough, but can turn into severe coughing fits that end with a whoop sound when breathing in. It's an airborne illness caused by the Bordetella pertussis bacteria. Dr. Penny Borenstein, the SLO County health officer, says the rise in cases after low numbers during COVID is part of a usual pattern.
We tend to see peaks and valleys with this disease, and it's really unclear why. But in typical cases across the time frame, we tend to see every 4 years, maybe a little bit longer, that cases rise much more than they do usually.
Statewide, nearly 600 Californians had contracted whooping cough as of the end of April, according to the CDC. Infants under 1 year old are most at risk for serious complications. Borenstein says the most effective form of protection is a vaccine, usually given to kids as DTaP and later as a booster called Tdap. Adults who weren't vaccinated as children are encouraged to get a single dose. Borenstein also recommends staying away from anyone who's coughing or sick. For KCBX News, I'm Amanda Wernick.